Today we're going to talk a little bit about retainers. After you get your braces off, if you're going to have a retainer both on the top and the bottom, and some of these retainers are going to be removable, and there's a lot of different types. So if you want to be able to take care of them so that you don't have to get a replacement. The first thing you need to do is you need to wear the retainer as prescribed by Dr. Staggers all the time except eating and brushing until she tells you you can wear it at night. When you put the retainer in, what you want to do is put it in and press it with your fingers in the back. Don't bite it in, because if you get it in there and you get it cattywampus and you bite down, you can break both the wires and the plastic. So always push it in from the back here, pushing down with your fingers. Now when you look at it taking it out, it's a common misconception that you take the retainer out by pulling on the front. And the problem with that is if you continuously pull it from the front, what's going to happen is this is a metal, and where it meets the plastic is a weak part. So you're constantly pulling it down and you're pushing it up to put it in. Pulling it down to take it out, pushing it up, and it ends up breaking right there. And that's something that can't be fixed. You have to remake the retainer. It's better to grab the retainer by the clasp in the back. Now, not all retainers have this kind of clasp. Sometimes retainers have clasps that look like this. They're called Adam's clasp. Sometimes they look like this. They're called ball clasp. But what you want to remember is you want to get a hold of both sides and pull down from the top, or if it's the bottom retainer, you want to pull up. Let's see. So on the bottom, you would reach in the back and pull up rather than try to do something from pulling like that, because you're going to break it right there. The next thing you want to do is you want to make sure you keep it nice and clean. And you just want to take a toothbrush and toothpaste if you have this kind of retainer with colored plastic, and you want to brush the tissue surface of it really well. You also want to do the shiny side, but this is the side that tends to stay pretty clean. But you want to scrub the tissue side is the little tablet cleaners. Now these little tablet cleaners you can get here at Julie Staggers Orthodontics. You can also buy them at the grocery store, but what you want to be careful about is you want to make sure you don't use denture cleaner, because denture cleaner tends to be too hard on this plastic and it tends to eat little holes in it. Then it makes it even harder to clean. We also have these neat little ultrasonic cleaners, and you open them up and you put water in them, and you drop the tablet in there and you soak the retainers in it. The important thing to remember with using the ultrasonic cleaner is you don't want to use hot water or even, warm water, just room temperature water, because this is actually plastic. And if you use hot water on it, it's going to melt or distort, and then it won't fit. The other type of retainer that we have is the clear type retainers. And what you want to remember with the clear type retainers is, once again, you want to grab them from the back and push them in down to get on the top and up on the bottom. When you seat them, you want to line them up on the teeth and push with your fingers in place. Never bite the clear retainers in place, because you can break them. When you take them off to clean them, the plastic stays nice and clear if you keep it clean, but if you tend to use toothpaste on it, it tends to make the plastic brittle and not as clear. So with a clear retainer, what you want to do is use your toothbrush and just water, or you can use a specific retainer cleaner tablets that are good for clear plastic. The other thing you want to make sure is when you clean your retainer and you're holding it, the tendency is when they're U-shaped like this, or when it's a lower retainer, you tend to want to squeeze hard. And what you got to be careful is that the plastic can flex and it actually can break in the middle. If you look right here, you can see this one is where it broke in the middle because of squeezing it too hard. The very common thing that you really don't want to do is you don't want to wrap a retainer up in a piece of paper like this. Now lots of people do this as they wrap it up. It looks nice and neat, nice and convenient, but the problem is when you see this, it looks like a piece of garbage and it gets thrown away. And that's what happens to lots of retainers. When the retainer is not in your mouth, what you want to do is put it in the case. And you want to put it in the case very carefully. You can't just throw the retainers in there any old way and then slam the lid shut, because you can catch the wires and bend the wires and also break the wires. So you want to make sure that when you put them in the retainer, you want to carefully place it in the retainer so that none of the parts are near the edge of the retainer case. And you want to make sure you have enough clearance so that when you close the lid, you're not mashing it. And whenever they're in a box like this, they don't get lost. Nobody confuses this as a piece of garbage. Dogs, can't open the box to get in. I don't know why retainers are so popular for dogs to eat, but they just are. But if you put it in a retainer box, your dog will never be able to get it. For the clear types of retainers, so you want to make sure that you set them so that they are completely in the case so that they are not hit with the lid.